They line up parallel to one another, perpendicular to the plane of occlusion, and they're still concentric within the arch. Clean out a little bit of the wax. And there you go. And there we are with all 6 of them in position. Notice once again, centrals sit down flat on the plane, laterals up just 1/2 millimeter, 1/50th of an inch, canine tips down on the plane, the necks of the canines just a little bit more prominent than the incisal edges. So let's get a start on doing the lower ones now. Put the pin back in, maintain our vertical dimension. And once again we start with our central incisor. Now in some clinical cases you may find that you're not going to get an absolutely textbook perfect millimeter over bite, millimeter over jet situation. Some cases where you've got a skeletal class 2 jaw relation, you may actually have a denture patient wind up looking like a bottle opener. But that's part of getting a denture that is physiologically compatible with the patient. You have to have the lower teeth in their proper relationship to the lower ridge. The imaginary roots of this tooth have to extend backwards and downwards into that remaining residual ridge. Remember, that's not gum down there. Gum is the same thing as gingiva. Gingiva is a periodontal tissue around teeth. That is alveolar mucosa we've got down there. Now see, here we've got our central incisor. Mesial edge lines up with the mesial edge of the upper central. Labial surface is perpendicular to the plane of occlusion and parallel to the labial surface of the upper central. That took not too horribly long to do. The thing that people that are new to this have to do is overcome their fear of getting in there and setting teeth. This is wax. It's not like things are literally going to be set in stone. If you're not happy with something, by all means go back and change it. Notice that this time around I'm using the number 7 wax spatula instead of the number 31. We're dealing with smaller teeth and I don't need to remove quite as much wax. After you've set your central and you're happy with its position, you go back and you set the canine next, because that's going to be the keystone down here. And the incisal point, that tip on the canine, has to point straight up in this embrasure between the lateral incisor and the canine. Lots of room down here. It's a lot easier to get the wax nice and mushy soft, literally, and hold the tooth in position for a couple of seconds until the wax solidifies again, than it is to say, oh shucks, it's not soft enough, and then have to take the tooth out, go back, soften things up again, and keep on coming back again and again and again. Okay, now I'm going to move it up so that the tip points straight up into the embrasure. The mesial incisal line angle of the upper is parallel to the distal incisal line angle of the lower. So the neck of the lower tooth is just a tad more prominent than the incisal edge. It's also very important at this stage to remember to keep the excess wax off the occlusal surface of your wax rims, or you're not going to be setting them at the proper vertical dimension. That's where your pin comes in handy. Aha, it's down there at the right vertical. And when I move off to the side, there should be just this hair's breadth of contact between the canines. Wax is still soft, so I can make my adjustments as I need them. Great, that's exactly where I want that to be. I know you may not think it the first couple of times you do this, but this can actually get to be fun after a while. It's one of the few opportunities you have in dentistry to be outright creative. A lot of what dentistry is problem solving. And there's a person with a decayed tooth or periodontal condition that needs to be rectified. And you go in there and apply the proper techniques to rectify the situation. Whereas in full prosthetic dentistry, you got a patient comes in with absolutely no teeth, and we have to fabricate an entire dentition for them. All right, once you've got the canine in position, then you go back and do the lateral incisor. Lateral incisor acts as sort of a filler tooth. It's obvious that the central incisor is important for maintaining the midline relationship to the patient, and the canine is very important for establishing the beginnings of the posterior occlusion. Lateral incisor, as you will recall from dental anatomy, is slightly larger than the central. So that if you're going to have a problem with crowding in the anterior, this is the tooth that you're going to do your grinding on to get things to fit. Naturally, in this best of all possible dental worlds, we're not going to run into that problem here today. Just make sure that the incisal edges of the two incisors stay flat on your plane of occlusion. Now look at this. When we go into the lateral motion, how the offset of the upper lateral allows it to slide past the lower incisors when you go into a working motion. Neat, huh? It all fits together. I remember reading somewhere once that learning to understand proper occlusion is a great deal like learning how to decipher hieroglyphics. I don't know that it's all that esoteric, but it can be rewarding, and I'll say it again, sort of almost fun, trying to develop the proper relationships. There we go. We got one side all lined up according to Hoyle. Just the slightest little bit of clearance between the two canines in the centric position. You need that so that you will have the proper contact when you go into a working motion. And once again, in order to establish that we've got our midlines into proper location, we're going to set ourselves another central incisor here.